uh, whatever veins you see, whatever veins you see, uh, like whatever artery you have in the deeper aspect of the body, you will have the same vein also. Okay, so for example, if you see, you have the carotid artery, you have the jugular vein. Okay, this is internal jugular vein and this is the external jugular vein. Okay, this external jugular vein is running on the sternocleidomastoid muscle. It is running on the sternocleidomastoid muscle. Okay, you can see here this external jugular vein, and the veins are more superficial. Okay, so likewise, when all the veins bring the blood towards the heart. For example, this is the heart level, and all the part above the heart, like upper limb, head and neck, all this vein comes and drains through this superior vena cava. This is the superior vena cava. Okay, this is the superior vena cava. Okay, so and here this is the superior vena cava, and this is the right brachiocephalic vein, and this is left brachiocephalic vein. So if you see, this is formed by this internal jugular and the external jugular. So external jugular vein drains all the blood from the face. Okay, whereas the internal jugular vein, it is formed by this jugular bulb. This is a jugular bulb. Okay, this is a jugular bulb, and inside the brain, if you see, there are dural venous sinus. Okay, which is collecting the venous blood in the brain. Okay, so this is the dural venous sinus. I have discussed a lot about this dural venous sinus in the nervous system. Okay, this is the dural venous sinus and superior. Okay, you see, this is the dural venous sinus. They are not blood vessels, they are nothing but the folds of the dura mater. Okay, all the blood that's supplied by circle of Willis is getting deoxygenated, and those deoxygenated blood comes through the superior sagittal sinus, inferior sagittal sinus, and this is the straight sinus, and this is the transverse sinus, and this is the sigmoid sinus, and this is the jugular bulb and the internal jugular vein. Okay, next, coming to this subclavian artery, there is subclavian vein. Okay, this is the subclavian vein. That is continued by the axillary vein. So what you have to do is, this is this deep vein. I am speaking only about the deep vein. I am not coming to superficial veins. Superficial veins I will explain separately. Okay. Then, like in this abdominal aorta, you have this inferior vena cava. Like in the abdominal aorta, you have the inferior vena cava. You can see the abdominal aorta is running in parallel with the inferior vena cava here. Okay, and when you catch this inferior vena cava, it is collapsible in nature, and even in the cadaver, all the clotted blood are present in the veins, but the arteries will become empty. So in the inferior vena cava, in the abdominal region, you have this hepatic veins. Okay, this is the hepatic veins. In the digestive system, I will teach specially about this hepatic vein and the portal vein. Okay, this portal veins is a venous network that is connected between this. The portal vein is the hepatic network that is connected between this intestine and the liver. Okay, if I show all the branches of the intestine and the liver, you can understand. So this portal vein is not connected to the inferior vena cava. Okay, this portal vein is not connected to the inferior vena cava. It is bringing the venous blood from the intestine and then it is taking all the venous blood to the liver. You see, here is the place where you have the liver. Okay, this is the place where you have the liver. Okay, and this portal vein is entering into the liver through the porta hepatis. So here this portal vein is starting as a small venule, and in the intestine also the portal vein is starting as a small venule. That's a speciality. Okay, in fact this portal vein has pressure. It is around 13 by 7 millimeter of mercury. Okay, so the portal hypertension is a condition where it due to liver cirrhosis. So we don't want to go into pathology. Just know that this is a portal vein, and the liver is. These are the blood vessels that is entering into the liver. These are the blood vessels that is entering into the liver, hepatic vein. Okay, these hepatic veins will from the liver will go I mean the portal vein will give all the venous blood from the intestine to the liver will process it and send the venous blood to this hepatic vein to the inferior vena cava. The hepatic vein is connected to the inferior vena cava here like this, and you have the location of the liver here. You have the location of liver here. Okay, so the portal vein venous route is different, the hepatic vein route is different. Okay, so likewise in the abdomen you have the renal vein, inferior phrenic vein. See, this is the renal vein, right and left renal vein, and these are the superior mesenteric vein, and the inferior mesenteric vein forms the, this is the superior splenic vein. Okay, and the superior and inferior mesenteric vein, this is the superior mesenteric vein, and this one is the inferior mesenteric vein. Sorry, this is the inferior mesenteric vein, and both these vein forms a portal vein. Portal vein enters into the liver. The portal vein is entering into the liver. Okay, likewise coming to the lower limb, like the external iliac artery, you have the external iliac vein. Okay, one thing you have to remember here. Okay, you see the external iliac vein is running medially, whereas the femoral artery is running in the lateral aspect. So whenever you don't get blood, what you have to do, you have the inguinal ligament between this pubic tubercle and the anterior superior leg spine. So you have to palpate the artery and inject the needle just adjacent to the pulse. Thereby you will enter into the femoral vein. Okay, so this is the clinical point you have to understand. The femoral vein is medial to the femoral artery. Okay, then like this femoral artery, you have the femoral vein. Okay, then like this popliteal artery, you have the popliteal vein. This is a popliteal vein. Okay, likewise now you like the posterior tibial artery, you have the posterior tibial vein. This is the posterior tibial vein and the fibular vein. Now I am going to focus only on the superficial veins. Okay, these superficial veins are running under the skin, but this superficial vein is connected to the deep veins. Okay, this superficial vein is connected to the deep veins. So what I did, this is the axillary vein, this is the axillary vein, this is the axillary vein, and this is the cephalic vein. This is the cephalic vein. This cephalic vein is coming on the deltopectoral groove, and then it is traveling in the lateral aspect like this. It is traveling in the lateral aspect. Suppose if you want to puncture the needle, you have to block this vein here so that this vein will swell. Okay, likewise this is the basilic vein that is running in the medial aspect. Okay, and this basilic vein is also connected to the deeper vein. I'll show you. You see here. Okay, this is the basilic vein connection. Okay, it is also going and joining to this axillary vein. This is also going and joining to the axillary vein here. Okay, so the cephalic vein is also joining to the axillary vein, the basilic vein is also joining to the axillary vein. Okay, and these are the brachial veins. Okay, now next, in the elbow joint at the cubital fossa, you have this median cubital vein. This is a common vein where you puncture to take the blood sample in the laboratory. Okay, even for obese patient, if you make a tourniquet here and stop all the blood flow and tap here, this vein will bulge and it is easy to prick and take the samples. And these are all the intercommunicating veins. These are all the intercommunicating veins. These veins communicate between the cephalic and the basilic veins. Okay, so these are the superficial veins of the upper limb. Then coming to the superficial veins of the lower limb, in the median side you have the longest vein in the body, longest blood vessel in the body, that is called as the greater saphenous vein. It starts in the medial malleolus region and goes all the way in the medial side, and then in the femoral triangle it goes and inserts, it goes and joins to this deep femoral vein. This is the deep femoral vein. This is the deep femoral vein. Okay, so the greater saphenous vein, or also called as medial saphenous vein, is going and joining to the deep veins here, because it is taking the blood all the way through this region. Okay, so this is a vein that is harvested during the time of angioplasty. What they do, they harvest this vein, then reverse it, and then connect it to the blood vessels of the to bypass the heart. Okay, so then in the lateral side you have the lateral saphenous vein. This is the lateral saphenous vein, also called as a small saphenous vein. This small saphenous vein runs in the lateral aspect, and then it goes and joins to the popliteal vein. This is the popliteal vein. Okay, it is joining here. So now this popliteal vein is running, it is running in inside this muscle. Okay, inside this muscle you can see these are all the deep veins that is running inside this muscle. These are all the deep veins that is running inside the popliteal muscle. So what happens, whenever you walk, the soleus muscle that I removed now is acting like a peripheral heart that keeps pressing these veins and pushing the blood up. Okay, so that's why patients who are bedridden, the blood will not go up. Okay, then the blood will clot, and that condition is called as deep venous thrombosis. So that clot will detach and go all the way up to the inferior vena cava. Then it will go to the right heart. Then from right heart it come to right ventricle. Then it goes to the pulmonary vessels. It goes to the pulmonary trunk and block the lung pulmonary arteries. Okay, once the pulmonary artery is blocked, then the patient will die of embolism. Then the patient will die of DVT with embolism. Okay, pulmonary embolism. The cause of death will be deep venous thrombosis with pulmonary embolism. So in those kind of patients, they will be suffering with pedal edema. There will be edema and pain. Okay, immediately you have to immobilize the patient to save the life of the patient. Okay, so then there are valves inside these vessels. Inside this vessel there will be valves. Okay, if these valves are damaged, then these blood vessels will swell and cause varicose vein. You can Google it, varicose vein. VERICOSE, varicose vein. Okay, so these are all the points you have to know about the veins. Okay.